So let's finish on our intellectual part. So the intellectual remaining bit was this aspect of memory, but we covered most of the aspects. So it is just to acknowledge we were able to see how memory is normally incorporated into the brain using some of the neuronal synapses, or rather some neuronal network, and some of the changes that are likely to take place within the brain anatomically to be able to represent some form of memory. So there are some specific important regions within the brain that are charged with that responsibility of storing the memory. So the role of specific parts of the brain in the memory process. So one of the areas that we mentioned was the hippocampus. So hippocampus, for you to appreciate maybe its important role, you can actually notice that, especially when there's some form of lesion. So if there's some form of lesion within the hippocampus, an individual is likely to have an anterograde amnesia. So with anterograde amnesia, that means that whatever they'll be interacting with in future, they'll not be able to incorporate or commit that into the memory because hippocampus is good for storing the incoming memories, or storing the incoming events and storing them into memory. So the hippocampus, located in the medial temporal lobe, is crucial in the forming of new verbal and symbolic long-term memories. Removing the hippocampi does not affect the old memories, but it prevents the formation of new long-term memories, a condition called the anterograde amnesia. So this patient cannot store new declarative memories beyond a few minutes. This is because for them to commit that, this is actually dependent on the well-being of the hippocampus. So why is it very important? This is because the hippocampus connects the reward and the punishment centers in the limbic system, which helps determine which experiences are emotionally important. Remember what we were suggesting, that before you commit an event or any information into your memory, the brain has a way of deciding if that information is important or not. And we are able to suggest that the limbic normally plays that important role in determining which is important and which is not important, because it is charged with that emotional responsibility. So the specific part that connects to the limbic system is normally the hippocampus. So minus the hippocampus, it means that the limbic might not have a direct way of communicating to the cortex. So pleasant or unpleasant experience stimulates the limbic system, and the hippocampus helps prioritize and encode this memory. The dorsal thalamic nuclei also assists in this emotional filtering and decision making for memory storage. So remember, the thalamus was also involved, specifically the dorsomedial nuclei of the thalamus. So we also have the retrograde amnesia, forgetting what you experienced in the past. So this is not likely to be affected when you are having a lesion at the hippocampus. So that means it is mostly important for encoding and not really storing what you should be already having. So the retrograde amnesia is the loss of memories from the past, often recent events more than the distant one. Distant memories are better preserved because they've been repeatedly rehearsed and stored across multiple brain regions. Some hippocampal lesions can cause both antegrade and the retrograde amnesia, suggesting a shared mechanism. Thalamic damage might cause retrograde amnesia alone, possibly because the thalamus help retrieve, search for stored memories, and not just encode them. Remember what we were suggesting, particularly with the role of the thalamus, in that most of the information that will end into the cerebral cortex most of the time needs to pass through the thalamus. So the kind of information could be memory related. retrieving information maybe from the hippocampus or from various areas of the brain. So the only reason why the a lesion in hippocampus is not affecting the past memory significantly, it is because of this repeated rehearsal. So when you when you retrieve this message repeatedly, they are able to be stored into the multiple areas of the brain. So even if the hippocampus is affected, it means that you might still be able to access the memories. So lastly, we can also say that hippocampus or the hippocampus are not essential for reflexive learning. So reflexive learning, literally, these are fine motor skills that maybe are needed by individual. These include such as playing sports, typing, riding a bicycle, instrumental skills. These types of learning is called reflexive learning. So most of the time, the hippocampus is not needed in storing this kind of information or this kind of procedure, because remember, as your motor is able to repeat that consequence, these are also some types of memory. So this specific type of memory should be with the under the reflexive learning. So those with the hippocampus damage are still able to perform these physical and motor skills, and they are included as we've suggested. So this is referred to as the reflexive learning or procedural learning. It relies on repeated physical practice and not mental rehearsal or verbal reasoning. Thus, reflexive learning is independent of the hippocampus. And it makes much more sense because we suggested that when you talk of the memory, it is not only a role or maybe a function of the central nervous system or maybe the brain at large, but we suggested that the memory responsibility can also be performed by the spinal cord and some other areas of the CNS of the nervous system. This is because of storing these repeated motor skills. So those can be stored in other areas and not necessarily the hippocampus. So the hippocampus is good for declarative. So remember, the declarative were the types of memory that represented the facts and events that happened. So that is with our brief coverage of the intelligence, majorly focusing on the language. We were able to see the language, how we are encoding information into the brain, and how we are storing, and that is the memory. And of course, we need to have a way of retrieving our memory from the storage area, and we need a way of again coding our language into words. So all that represents some form of intelligence. Remember, this was not a 100% representation of intelligence. We were also able to acknowledge the other types of intelligence. This is again should be under those other types of intelligence where we don't require the hippocampus. We just require some other parts. So this is similar to what we suggested in the non-dominant occipital temporal area, or the non-dominant Wernicke's area, that were also able to perform some other skills that were not necessarily revolving around language. So beyond intelligent, we will also want to explore the behavior and of course examine the motivational mechanism of the brain. So this motivational mechanism should be the background of our behavior. So even though we'll not major into the psychological aspect, but we'll just appreciate some of the proposed neurophysiological mechanism that can be able to describe behavior. And remember, while we are describing behavior, we will not be specific into a certain type of behavior that is prompted by a certain mechanism, but we'll just be speaking in generalities. So maybe for the specific type of behaviors, we have more of psychological explanation than physiological. So another area of the brain that becomes again very important when we talk of the behavior, you cannot afford to ignore the limbic system. So remember, we've been able to suggest the limbic system as very good in intelligent, in that with the limbic system, just a minute. So let's tackle the behavior part. So anytime you think of a behavior, even at a psychological level or in whichever level, just know that behavior represents a behavior can represent some motor, some form of motor, I'll say some motor actions. This means your behaviors can be identified by those people who are surrounding you. So they can be externalized. And what are you externalizing? Basically with your behavior. So anytime you are behaving, it is like you are representing your mental process or some thought process within your brain. So you are behaving in a certain way because there's a particular thought in your brain. What you need to note sometimes is that with some behaviors, you can easily identify the thought that is prompting you to behave in a certain way. But there are some behaviors where you might not be able to know the exact thought that is prompting you to behave in that manner. And this is why you are able to suggest that when it comes to thoughts, you can have conscious thoughts, that which you are aware of, and you can have unconscious thoughts. Sometimes they don't follow a specific logic. So that which you are not able to account for, or you are not able to acknowledge immediately. But either way, your behavior will still be there, or in your way of acting, we might be able to suggest or maybe have a clue of what maybe you are thinking. So that is from the psychological aspect. A behavior is a representation of the thoughts in your head. So the thoughts does not need to be conscious. They can either be conscious or unconscious. But when it comes to the physiological aspect, you go deeper and suggest that you are behaving in a certain way because of some neurostimulation that occurs within the brain. So there are some specific areas within your brain that are receiving some neuronal impulse to prompt you to behave in a certain way. And these neuronal impulse are using some specific pathways within the brain. So remember, while we are talking about the neurotransmitters, we suggested adrenergic pathway, majorly releasing noradrenaline, serotonergic, cholinergic, dopaminergic, releasing some various neurotransmitters, using some various fibers or some various tracks. So in the brain, you can refer them as tracks or pathway. So we'll be able to see how you can associate some neurotransmitter to some specific form of behavior, for lack of word. So let's examine the activating or the driving system of the brain. For somebody to behave in a certain way, there needs to be a motivation. So the motivation, you can explain it in some psychological, in a psychological manner, but in this case, we'll just limit ourselves to the physiological. And when you say the physiological, you're thinking of activation or motivation in form of electric impulse. Without continuous transmission of the nerve signals from the lower part of the brain into the cerebrum becomes useless. In fact, severe compression of the brainstem at the juncture between the mesencephalon and the cerebrum, so remember the mesencephalon, the midbrain, sometimes results from a pineal tumor often causes the person to go into unremitting coma, lasting for the remainder of his or her life. So that means you just seated in class over there. It means that you are having some muscles that are excited, some are inhibited, where now you can be able to display that sitting mode, posture. Physiologically or even psychologically, that is a kind of behavior that you are displaying. And how is that possible? So that is possible because remember the motor region of the cerebral cortex has somehow been activated to send the necessary impulse to the lower motor neurons, some to be able to cause excitation, some inhibition, so that you are able to assume the current posture that you are having, whether you are sleeping, whether you are seated, or whichever behavior that you are displaying. Maybe you are walking. So anything that is observable by an external person will suggest that as a behavior because it is representing a kind of a motor activity. So even you by sleeping, that's a form of behavior. How can we be able to achieve that? We are able to achieve these things by the signals that are emanating from our brainstem. And remember, we are going to use the different neurological pathways or some different neurological tracts that release some specific neurotransmitters to be able to give us some specific states within the body, or rather within the brain. So nerve signals in the brainstem activate the cerebral part of the brain into two ways: by directly stimulating a background level of neuronal activity in wide areas of the brain, and by activating the neurohormonal system that release specific facilitatory or inhibitory hormone-like neurotransmitter substance into the selected area of the brain. So I want you to remember, while talking about the cerebral cortex, we were suggesting that with the cerebral cortex, we were suggesting that if you have the brain, if you have the brain, the sensory part receiving the information, they should have a way of communicating to the motor before relaying signals back to the lower part of the brain. So this is what we are suggested. We are having incoming signals all the way to the sensory part. They'll be integrated at the sensory, and then the motor will pick the signal and give us appropriate motor response. So we are told that this is not possible if we do not get some excitation signals that emanate from the brainstem. So for this communication to be possible, or for us to have an adequate excitation of the motor part, we also need some massive contribution from the brainstem using the various pathways that we are going to just see. So if that is not possible, we won't be able to get a motor reply. And that means an individual with no motor reply, it's almost equal to sleep or to the very extreme coma. So the brainstem is very important when you talk of the activating or the driving system of the brain. This is because when you talk of the behavior, we've suggested that that is a motor response, and the motor response should be executed by the cerebral cortex, specifically the primary motor area. And it is not merely a communication between the sensory and the motor part. We also need to get some excitation from the brainstem. So, for example, this is one of the pathways. If you can be able to see this, this is an adrenergic pathway, meaning that we are having a major nucleus at the brainstem. So this nucleus is referred to as the locus coeruleus. Remember, while we are talking about the adrenaline, we suggested that adrenaline in the brain are likely to be produced from the locus coeruleus. So we are having their cell body from there, From there, they are able to put out their axon to to innervate the various region of the brain. So one specific area that you are interested in is specifically the motor area. And of course, not only the motor area, these signals can spread and also involve the cortex. Remember, we suggested the cortex, the prefrontal cortex, that is, as at the cerebral, was very important in the working memory, or when it comes to some form of intelligence, things like attention, concentration, where we suggested that if you have low level of neurotransmitters, that is noradrenaline, you won't be able to achieve the right concentration and the right attention. So how is that possible? That is possible because we are having the locus coeruleus producing this adrenaline massively within the locus coeruleus and then spreading out their axon to innervate various regions of the brain. So these are referred to as the adrenergic pathways. So one of the areas that they are likely to stimulate is the motor area. And you might want to think of some situation where the motor activity somehow increases, especially in a state of fright and flight, where you need the noradrenaline to be there and some muscles to be activated so that you are able to fly, not fly, of course, but get away from danger, especially in some fright circumstances. That is a motivation that is coming straight from the brainstem. Not that ordinarily you'll not react, you'll react, but this time around, we want you to react with an increased intensity. How will you react towards a danger? That is a behavior that will depict moving away from a danger. We should be able to see you running or maybe getting aggressive towards it if you feel you can manage the danger. So these are the different kind of behaviors that you are going to display. And physiologically, we are seeing why you are displaying that. This is because we need to get some extra stimulation from the brainstem using the adrenergic pathway. And that is the locus coeruleus releasing adrenaline that goes to the very important areas. So it could be our focus now is at the cerebral cortex, the motor, but it can also go to the prefrontal cortex. It can also go to the limbic, the amygdala, and the hippocampus. So they have very, very important roles. So that is adrenergic pathway. You need to remember that. So we also have some other pathway, dopaminergic pathways. So we suggested we have up to around 4 dopaminergic pathways. But that which is very important for the motor, is normally what you can refer to as the nigrostriatal pathway. So that is a dopamine pathway that also controls some motor activity. And where they originating from? Around this area, around the midbrain. So this is part of the not exact part within the reticular area, but you can think of it as the hindbrain or some part of the brainstem. So most of the time they normally originate from this area. You call it the VTA or the ventral tegmental area. Some might end at the nucleus accumbens. So this is a dopaminergic pathway. So we have up to 4. The mesolimbic. So this is referred to as the mesolimbic, starting from the ventral tegmental area all the way to the nucleus accumbens. So this is very important for emotions. Remember the nucleus accumbens, if you see its location, it is just close to the limbic area. So this is just within the limbic system. We can also have some from the ventral tegmental area and gets all the way to the cortical. So these are also important in controlling the mood of the individual. So remember, mood is also something that is likely to control the behavior. You are going to behave differently with different moods. If you are somehow happy, you are likely to behave in a different way, unlike when you are unhappy. So all these are very important. So this is uh, mesocortical, the mesocortical pathway, still under the dopamine pathway. So we'll be able to see the specific role of each of this pathway later in our behavior. And we can also have another one from the originating from the substantia nigra all the way to the stratum. So if you remember the basal ganglia, the stratum where we have the where we had the caudate and the putamen, so those should be the stratum. So the specific type of fibers are also dopaminergic fibers originating from the substantia nigra. So producing dopamine and releasing it at this point. So they are serving a very important role. And we also have another one within the hypothalamus from the tuberous part of the thalamus to the infundibulum, forming the tuberoinfundibulum pathway. This was an important pathway, especially if you extend this to the endocrinal system, where we suggested the decrease in dopamine is able to encourage the production of prolactin. So on top of the dopaminergic pathway, we also have the serotonergic pathway. So that means these are pathways that majorly uses the serotonin as their neurotransmitters. So from the brainstem, so this specific area is referred to as the red nucleus or the media raphe or the raphe nuclei. So red nucleus, that is, from the red nucleus, they can extend their axon to innervate most parts of the brain, so including our motor part, where we are suggesting that it needs to be excited to act. So for the serotonin, we normally have two major. We can have the that which originate from the red nucleus, while we can also have that which originate at the raphe nucleus. Remember the dorsal raphe nucleus that normally forms part of the descending pathway. If you are able to remember the analgesic system here, we suggested that in between here, we can be having something like the periaqueductal tract that uses some opioids to activate this raphe nuclei. Raphe nuclei descend all down to the spinal cord to be able to give us, to be able to prevent the ascending pathways of the pain signals. Remember the spinal thalamic, either the neo or the palliator. So on top of that, we also have the the cholinergic pathways. So the cholinergic pathways are likely to start from the basal area of the brain or the base of the brain, where we have what we call the basal nucleus of Maynard. So from here, they are able to spread their different pathways to the various areas of the brain. So what we should just be we should just be getting not the detailed part of it, but we should just be able to acknowledge that our cerebrum is not just acting because they are getting some sensation from the, or maybe they are getting some impulse from the sensory part of the cerebrum, or that is the motor part that you are referring to. They are not just acting independently, but for them to act, they require some signals from the brainstem. And scientifically, that has been shown to be true, especially when these neural pathways have been cut off. If they are cut off, an individual is likely to get into a coma. Because remember, somebody who is in coma or not sleeping, or maybe sleeping, they are not displaying they are not displaying an active behavior, and therefore they are likely to assume a sleeping or unconscious state. So the driving system are majorly from the brainstem, and we are likely to use various pathways. When you talk of a pathway, you are referring to a specific track using a specific kind of neurotransmitter, where we've been able to suggest the four main: the cholinergic, the dopaminergic, the serotonergic, and the adrenergic pathway. So how do you control the brain activity? This is the same thing that we've suggested. The brain activity, for the brain to be active, we need to get some firing from the brainstem. So that means we should be having some excitatory signals from the brain. The specific area, the specific areas are from the major nucleus that we've seen from these tracks, but we'll just see them again. So the reticular excitatory area, also called the bulboreticular facilitatory area in the pons and the brain, midbrain that is, controls the brain's general activity level. So this area sends downward signals to the spinal cord to maintain the muscle tone and reflexive activity. And again, also sends some upward signal to the thalamus when they relay to the cerebral cortex and the subcortical areas. So that is the main reason why the brain is likely to be active from the brainstem. So the two types of excitatory signals, we have the fast and the short-term signals. So this is likely to use the cholinergic pathway. Remember from the basal area of the brain. So the neurotransmitter used here will be acetylcholine. Normally last milliseconds. So this can cause a brief and a quick excitation of the cerebrum. So what we are suggesting is for you to display a specific form of behavior, your brains need to be active. And for your brain to be active, it needs to be activated. And where are the activating signals emanating from? They are emanating from the brainstem, and they are using different pathway. So one of the pathway, cholinergic pathway, that is likely to give us a brief but quick activation. So you can also have the slow and the long lasting signals. So this originate from small neurons in the brainstem, travel via the slow fibers into the intralaminar and the reticular nuclei of the thalamus. They spread widely through the cerebral cortex, cause a prolonged excitability lasting seconds to minutes, crucial for maintaining the background alertness or wakefulness of the individual or maybe of the brain. And this will suggest the usage of the adrenergic pathway. Remember, the adrenergic, something like adrenaline and maybe serotonin and dopamine are very, very important in determining the mood of the individual. And I want us to say, when you are talking of the mood of an individual, you are not just talking about a one-time emotional state of the person, but you are referring to a sustained emotional state of an individual. So when you talk of a mood, uh, you are referring to somewhere from maybe sadness all the way to maybe normal happiness, but it can be extreme to euphoric level. Remember, psychologically, when you talk of the mood from in a spectrum from sadness to euphoric state, they also represent some energy level. We know that if you are sad, you are not likely to be active unless you are active in some destructive activity. When you are happy, you are likely to be active, but you are not likely to be active in some destructive activity. So you'll also be able to see the mood will also be able to change with some certain types of behavior. For example, if somebody is having a sad mood, because maybe they are having low level of serotonin at the serotonergic receptors, low levels of adrenaline and maybe dopamine. These people, they are not likely to be active, but if they are active, they are likely to be active in some aggressive activity or mostly destructive activity, such as fighting, and not this fighting in terms of sport, because that needs some intellect and some concentration. So that does not revolve much with the mood. But fighting out of aggression likely to emanate from the sad state of the individuals. So these neurotransmitters or these pathways, apart from the acetylcholine, can be very important in determining the mood of an individual, and not only the mood, they can also be important in making sure that the person is somehow active. So if somebody is active, we'll be suggesting that the brain is active, and that we can be able to see by the behavior that these people are having, or the behavior that these people are displaying. So that is possible through the slow and the long lasting signal. So the regulation of the brain excitation by the sensory input, cortex feedback, and the thalamus. I I know when you are talking, when you are suggesting that our cerebral part of the brain or the cortex is being activated by the brain stem, we know that the thalamus also need to be very competent, because if the thalamus maybe is not functioning okay, it means that even if you are having a good brainstem, this signal will not be able to pass through the thalamus and all the way to the brain. So we might still present with the same problem. So the thalamus is equally important. So the sensory input excites the brainstem excitatory area. So this is just examining to see, we are suggesting that the brainstem is activating the major part of the brain, but what is activating the brainstem? So the brainstem is being activated by the sensory inputs that we normally receive. One example of such sensory signals are the brain, are the pain. Remember the pain, more so the slow pain, which we suggested is likely to terminate at the brainstem area. When it terminates at the brainstem area, it can be able to activate the excitatory area of the brainstem, and that might influence the behavior of an individual. So that is just with the pain. And remember, it is not only the pain. We also have some sensory modalities that can excite the brainstem. So the brainstem is also active because it's receiving much of the sensory input. And I don't know if you're able to relate. Just imagine in circumstances or in situation where the sensation of an individual is quite depressed. So maybe there's no any physical stimulation by sound from the skin, from the eyes. So if that is not there, it means that you won't be able to excite your brainstem actively. And if the brainstem are not activated actively, it also suggests that it won't be able to fire much signal to the rest of the brain. And therefore, with no much signals coming from the brainstem, an individual is likely to be in a state, in a sleep state. So most of the time, you are able to sleep because of the reduced sensation. And we normally suggest that if you want to sleep adequately, you also need to control your environment. And by controlling your environment, we normally suggest that you reduce the sensations, be it maybe noise, be it maybe from touch. Some touch can trigger sleep, paradoxically, but you just want to reduce some sensations. So when these sensations are reduced, the brainstem will become less excited, and it will send less signals to the cerebral cortex. And when these signals reduce, somebody will be in a sleeping state. So this just emphasizing how the sensory inputs can be very important in exciting the brainstem excitatory area. So experimentally, cutting the brainstem above where the trigeminal nerves, that is the nerve 5, enter, remove most sensory inputs and causes severe brain inactivity, potentially leading to coma. So that means the brainstem also need to be activated. One of the important nerves that activates the brainstem, an example is the cranial nerve 5. So if the cut is made below these nerves, some sensory inputs remain from the face and the mouth, and at least coma is prevented. So I just want you to get, when somebody is not displaying any behavior, it means that they are just lying. And sometimes you can lie to a level whereby you cannot be aroused by some sensory stimulus. So that represents a coma state. So an inactive brain represents coma. And with a coma, you are not displaying a behavior. All your expression of behavior is at a zero level. And that is because you are not getting a signal from the brainstem, or maybe the brainstem are not getting signals from the sensory parts. So the sensory input can also be very significant in making sure an individual is alert or is displaying a specific part of behavior. So another domain, the positive feedback between the cortex and the brainstem. So when the brainstem activates the cerebral cortex again will send the same or not the same signal, but somehow some signal back to the brainstem that ends up activating the brainstem. And if the brainstem are activated back by the cerebral cortex, we'll just be seeing an unending kind of phenomenon that we can refer to as the loop. So loop is something, some form of repetition, back forth kind of signals. The brainstem as the origin of the neuronal impulse. Of course, they are getting the impulse from some sensory input, as we've suggested. They can send it to the cortex, and the cortex back to the brainstem, and will just be forming a loop, or maybe a functional reverberating or reverberation, or some oscillatory kind of neuronal flow. Remember, not at a one neuronal level where you're having an axon branching back, but functionally, if you complete the mapping, we are firing the cortex, and the cortex is firing back at us, assuming us is the brainstem. So this mechanism helps to sustain the wakefulness and the mental activity, enhancing attention and awareness. So maybe from the brainstem, remember we suggested the locus coeruleus, giving us or firing the adrenergic all the way to the cerebral cortex. The cerebral cortex firing back at the brainstem to make sure that it remains active, and that is how an individual is likely to remain alert or awake. Another aspect is through the thalamus. We've been able to suggest that thalamus normally function as a gate. So if you think of the signals that gets from the brainstem area all the way to the cortex, they need to pass through the thalamus. And we are seeing that the thalamus is not only allowing signals from the brainstem, they can also allow signals from the hippocampus region or for some other areas of the brain that are charged with the memory. So that once these signals pass through the thalamus, they can be able to get through the cortex and trigger the necessary, or maybe trigger the cerebral cortex to be active, because we are suggesting that if the brain is active, we are able to see a specific form of behavior. And remember, to physiological level, behavior refers to a displayed motor activity. So each cortical region is linked to the specific thalamic area. This we are able to demonstrate. Stimulation of the thalamus activates a corresponding cortical region. Signal reverberate between thalamus and the cortex, possibly aiding thinking and memory formation. So these are some of the mental processes that can benefit from this neuronal impulse transmission. Though not fully proven, the thalamus may also help in triggering memories or specific thought process due to structured circuit. So just what you just need to know is that physiologically, the brain becomes active because of some activation by these specific neurological pathways. But if you extend this to incorporate the psychological aspect, you'll suggest that we were able to say behaviors are likely to emanate from the thoughts. The thoughts of an individual will prompt the behavior that this individual will have. And remember, the thoughts that you are having are also dependent on the mood that you are having as an individual. If you are happy, you are going to have happy thoughts, and these happy thoughts can trigger some happy behavior. If you are sad, if you are having some sad mood, you are likely to have some sad thoughts, and these sad thoughts are likely to trigger maybe some bad behaviors, or sometimes destructive behaviors, or even though not having a behavior is also a type of behavior, because you are choosing not to display some motor responses. This is because that could be responding to the specific thought process that is currently there within your brain. Like for example, your thought process could be processing some other useful things, whereby if that is happening, it requires you to be still. So if you are concentrating, maybe you are doing you are meditating, there's some thought process within your brain. So that requires you to display a still behavior, or maybe a still posture, where it seems externally as though you are relaxed, because the thoughts that you are having, for them to be useful, they require a body that is relaxed, and you are able to see how your thoughts are influencing your behavior. And of course, you are relaxed, or you are having those thoughts because of some certain mood. So, in summary, when you talk of the behavior, we are suggesting that the major part of the brain, that is the conscious part or the cerebral cortex, need to be excited. So much of the excitation is likely to come from the excitatory area within the brainstem. And maybe again, still within the brainstem, we also have some inhibitory area. So where it can also send the same signals all the way to the brain, or maybe inhibit the excitatory area, so that we know when to reduce a particular behavior and when to increase a particular behavior. All these are coded and determined at least neurologically. So the two important area in the brainstem that we will be seeking to explore are the excitatory area. So remember, the excitatory area represent all those nucleuses that we've suggested, from the locus coeruleus and to the midbrain nucleus, where you should be able to activate and release some certain types of neurotransmitters. So when that is not wanted, we can increase this inhibitory neurotransmitter to get slow in the excitatory area. And this will be more important when we'll be talking about the sleep later, because remember, we are talking about behavior. Sleep can also be a behavior, at least physiologically. So whereby you'll be able to see in some states, this neurotransmitter can increase in amount to suppress the excitatory area. And if this area is suppressed, at least you can get into sleep, provided it is not overly suppressed. When it is overly suppressed, which is likely to be a case, especially in a disease process, will be having or an individual who end up having some coma or getting into a deep level of unconsciousness. So just be able to note that as the gross mapping of our neurological flow. Now getting into the specific details, but essentially just the same thing. We've suggested that for the brain to be active, they need to be activated by the brainstem, and they'll be activated by the brainstem by use of some specific brain pathways. These specific brain pathways employs or use specific neurohormonals or specific neurotransmitters. So we can have the norepinephrine system equal to the adrenergic pathway, and we can also have the serotonergic. We can also have the dopaminergic. So this is how the neurohormonal system of the brain controls the brain activities. Just essentially the same thing, but we are focusing now on the neurotransmitters. Which neurotransmitters are used in which pathways to be able to give us a certain physiological activity, and what is the important role of this neurotransmitter? This is because think of it this way: your brain is active. So when your brain is active, what does it achieve? It needs to achieve some specific things, and these specific things are dependent on the specific type of neurotransmitter that has been used to excite your brain. So what happens if you're having a specific kind of neurotransmitter in extreme quantity than the others? Are there some specific types of behavior that these individuals are likely to have? The answer to that is likely yes. So beyond the direct nerve signals, brain activity is also regulated by the neurotransmitters, or what you can refer to as the neurohormonal system. This can either be excitatory or inhibitory. They can act minutes to hours, enabling a long-term modulation. And by far, remember the cholinergic fiber or the cholinergic pathway, where we saw the acetylcholine being used, which is likely to be used within few minutes, but they are likely to give us a fast activation of the brain. So remember the two ways of activating the brain. So we're having the fast and the slow activation. So what are the main neurohormonal system? So these are according to studies that have been done in rats. I don't know which kind of humans, but possibly also in humans. So humans, it's mostly at the pharmacological level, where you give some drugs that increases some neurotransmitters, and you'll also be able to appreciate the particular behavior that will be displayed by these people. Or if you are doing a functional MRI, where you are able to see some changes in the neurological activities, so that can also be appreciated at that level. So one of the system, we have the norepinephrine system. This can otherwise be referred to as the adrenergic pathway, where the neurotransmitters will emanate from the locus coeruleus. Remember, the locus coeruleus anatomically is between the points and the midbrain junction. So there is where we find the locus coeruleus. So think of it as a major cell body sprouting out various axons to the various regions of the brain. So most areas that gets innervated by these axonal fibers or tracts will end up being excited, while in some other place, they might have some form of inhibition. So a good example of inhibitory effect, we are suggesting that for you to be focused, and remember when I'm saying focus, it means that you are only focusing on one specific task. So while you are concentrating, while you are focused on one task, you should be able to inhibit other non-important tasks. If you are just reading or you are just listening, you are listening. So that's a form of focusing. So for that to be possible, it means that there are some other areas within the brain that need to be excited, and there are some other areas that need to be inhibited, so that you do one thing at a time. An important neurotransmitter that can help you achieve this is norepinephrine. And some of the clinical circumstances that you might see in individual with low level of norepinephrine, they might not concentrate. The only reason why they are not concentrating it is because they are having divided attention. Their brain is not able to prioritize important tasks. They want to do everything at the same time. So you are in the class, you want to be outside, you want to be inside, you want to be seated, you want to stand. So you might end up having some hyperactive disorder. So a good example with that will be something like the ADHD. So attention deficit hyperactive disorder. So one of the hypotheses is that these people normally have low level of adrenaline. So from locus, as our major cell body, they are spreading down axon the various regions of the brain. Some of the functions of this system, they normally play a very important role in the rapid eye movement sleep. So this is a type of sleep where the eyes tends to move, or sometimes the body might move a little bit. Just think of ile time yenye if you sleep unapenduka kidogo. So that is a representation of the rapid eye movement. There's some form of activity. And at that point, if you dream, you are likely to remember. Unlike in some other type of sleep that we'll examine, the slow wave sleep. So we have the rapid eye movement sleep, or the paradoxical is just the same thing. So this is likely to be affected, or it's likely to be influenced by the noradrenaline. So if you're having adequate noradrenaline, you will be able to remember your dreams, because with the REM, most of the time you'll be able to dream, and sometimes it could be a physical dream that tallies with the sensation that you're getting. So if somebody talks to you while you are in this episode of your dream, you are likely to listen to them, but recreate your own things in a form of dream, but still not waking up. So we'll be able to see that later. For you, just note that norepinephrine can be very important in alertness. And for you to be alert, you need to inhibit some other things, and can also be important in the REM. We also have the dopamine system. We have various nucleus that can release dopamine. By far the major when it comes to the motor activities, the substantia nigra. But when it comes to mood, you can also extend that to the ventral tegmental area. So source is substantia nigra. Targets mainly the caudate nucleus and the putamen. Remember, these are the striatum. So this forms part of the nigrostriatal. Remember, we suggested that somebody just walking in a particular way, it is also a certain kind of behavior. And they're able to master fine movement of their limbs or their legs because they are having some adequate substantia nigra, caudate nucleus, and putamen. We are able to transition gross movement into some fine movement. So gross represents some cogwheel kind of movement where you are moving almost like a chameleon. You are not sure whether you are moving front or backward, but at the end of the day, we are seeing you moving in front. So you are moving back and forth movement. While if that is fine, we'll be able to see a smooth transition, somebody just moving forward. I don't want to say a snail, but I'll say snail, even though it's moving slowly, it can give you a fine movement where you're just seeing it transitioning to the front, rather than a chameleon, which is also slow, but it is having some cogwheel kind of movement. So this fine movement of the motor is normally aided by the dopamine system. A specific part of the dopamine pathway is the nigrostriatal pathway. So that is meaning some neurotransmitters emanating from the substantia nigra and emanating at the striatum. So the striatum, as far as the basal ganglia is concerned, this refers to the caudate nucleus and the putamen nucleus. So what happens when this area has an issue? You'll get a disease by the name Parkinsonism disease that normally can present with some fine tremors or some deficit of this function. So we also have the serotonin system emanating from the raphe nuclei. So the raphe nuclei can sometimes descend, what we suggested. When it descends, it normally gives us, it normally gives us some inhibitory, an inhibition of some neuronal impulse, specifically those that are ascending. And that's why in the spinal cord, these are very important to suppress the pain. And they can also give some inhibition, means that some of the areas that gets into the brain, the serotonergic impulse or pathways that terminates into the brain are able to release the serotonin. So remember, the spinal cord serotonin had some form of inhibition. They could inhibit the ascending pathways of the pain, functioning as the natural painkillers. So equally in the brain, they can also inhibit the brain activity. And remember, when the brain activity is inhibited, somebody becomes unconscious. If it is a healthy level of unconscious, you will end up sleeping. So serotonin system or the serotonergic fibers or the pathways are very important for sleep. So individual maybe with lesion of the raphe nuclei, they might end up not sleeping. They are just staying awake. And remember, this type of awake is not as helpful because you'll be feeling fatigued, but you won't be able to sleep. Because remember, when you sleep, at least you are able to rest your body. But in this case, there's need for you to rest your body, but the brain will not allow you to sleep. Why? You do not have a sufficient level of serotonin. We also have the acetylcholine system. We suggested that most of it is likely to emanate from the basal part of the brain, but we can also have some specific nuclei from the gigantocellular. So this exists in the brainstem, specifically in the reticular area. So this ascends through the brain and can also descend through the spinal cord. So they are mainly their main effects are normally excitatory. So remember, their effects are likely to be brief and not last for long. And remember, that's why we suggested that this can be very good for memory encoding with the acetylcholine. So their effects are mostly in the excitatory. So they promote awakeness and aroused nervous system. So this is the summary of the neurohormonal system, representing where we are having our major cell bodies within the brainstem. You are able to see the locus coeruleus going all the way to the brain, some getting to the cerebellum. You are also able to see the nuclei of the raphe releasing serotonin, some descending, some ascending, just the way we suggested, normally have some inhibition. Where to the brain, you'll get some sleep. To the spinal cord, it can inhibit some nauseating modalities such as pain. That will be a plus. And it can send its inhibition so that when you're sleeping, you are also having a relaxed muscle because we are also inhibiting some impulses from flowing. And we also have the gigantocellular neurons that allows the acetylcholine to be formed. So this is on top of what we suggested at the basal nucleus of myonata, the basal part of the brain. So the simple thing that we've just been suggesting, the brain will be active as a result of stimulation from the brainstem. And we've gone beyond to suggest the specific pathways that are likely to be used. The specific pathways uses specific neurotransmitters that is likely to serve various functions within the brain, and that is what we've explored with the major neurotransmitters. So on top of those major neurotransmitters, we can also have some minor neurotransmitters, not suggesting that they are not important, but they also have some specific importance, some in disease process, some in some other process, such as sleep. You can be able to see the histamine, epinephrine mimicking the norepinephrine, having the same thing, glutamate, and we should also be having some aspartate over here, somehow serving as an excitatory neurotransmitters. So in addition to the major system already discussed, the brain also uses many other neurohormonal substances which act as specific synapses or are released into the brain fluids. So this include enkephalin, gamma aminobutyric acid, glutamate, vasopressin, adrenocorticotropin hormone, the alpha melanocyte stimulating hormone, the neuropeptide Y, the epinephrine, histamine, endorphins, angiotensin 2, and the neurotensin. So I want you to find out maybe the specific role of each. But I know maybe we've discussed maybe enkephalins, the GABA to an extent, the glutamate, while covering the neuronal control by the basal ganglia, the vasopressin in some other neurohormonal things, the histamine in some allergic process and some sleep. So each of these plays a distinct role in regulating various aspects of the brain function. And the brain is only able to function if it's active. And that's why we are suggesting we need to have this driving force. So the measure of the driving force is emanating from the brainstem. And we've been able to see what is driving the brainstem. Most of the driving force from the brainstem is from the sensory input, and also back signals reverting back from the cerebral cortex and getting back into the cerebral or into the brainstem. So any question before we proceed? So remember, we are still talking about the behavior. Limbic system is very important. This is because we've suggested that a behavior is likely to emanate from a thought. And that thought, again, is likely to be influenced by the emotional status of the person. So what controls the emotion of an individual? The emotion of an individual is likely to be controlled by the limbic system. So when you talk of the limbic system, some literature might suggest a limbic lobe or anything, but it is not an anatomical region, but this represents a functional connection of the neuroanatomical regions of the brain where they are electrically connected. So the limbic system are very important in controlling the emotions. And we know emotions control thoughts, and emotions, after controlling thoughts becomes the behavior, the motivation for behavior. So most behaviors have motivations. Apart from some diseases, we'll be able to see maybe later in neurology medicine, you'll be able to see some diseases where you'll just be having some motor movement. So we can refer them to as some stereotypic movement, where somebody's just biting their nails, or maybe they are just shrugging their shoulder, not because they want to achieve anything. It is just as a result of some neurological problem or some deep-rooted thoughts that are not easily accessible by either the therapist, the psychologist, or by the individual, even in their deepest form of meditation. So the entire neuronal circuit that controls the emotional behavior and motivational drives is referred to as the limbic system. A major part of the limbic system is the hypothalamus. So again, remember hypothalamus, on top of the hormonal issues or the hormonal control that we saw, it is also important in the limbic system. And that's why some individual will suggest that your hormonal state could also be influenced by your emotions. And that makes much more sense because Hypothalamus is also an integral part when it comes to the emotional mapping anatomically within the brain, and that is the limbic system. So our major focus is with the hypothalamus, while appreciating some other subcortical structures or some subcortical nucleus that will control the behavior. So in addition to their role in the behavior control, these areas also control the many internal body states such as body temperature, osmolarity of the body fluids, the drive to eat, drink, and to control body weight. So there are many roles that you can see by the hypothalamus. So these internal functions are normally collectively referred to as the vegetative function of the brain. So that means if I don't know if you'll find the vegetative thing to be insulting, but when somebody tells you that you are a vegetable or your brain is a vegetable, it means that your brain is only reduced to some vegetative function, where you are all the functions that you are seeing does not require reasoning. For example, for you to eat, to drink, to control your body temperature, the osmolality, you don't need to reason. Those are vegetative functions of the brain. So what is responsible for that vegetative function is the hypothalamus. And they also control some aspect of the behavior. So when you talk of the limbic system, it is hypothalamus together with some other subcortical structure and some part of the cerebral cortex, majorly a part of the temporal lobe. So this includes the septum, the para-olfactory area, the anterior nucleus of the thalamus, some portion of the basal ganglia, the hippocampus, and the amygdala. Collectively, all these forms the limbic system. And of course, you'll need to have an extension into the part of the temporal cerebral cortex. We've said that this is not a true anatomical region where you can just say that these are just structures that are joined, that they are just joined physically. They are normally joined by these electrical impulses. So the best kind of circuit to describe the limbic system is normally referred to as the Papez circuits. So that means with the Papez circuits, you are just examining how the information are flowing from one part of the limbic system to another, where some of the integral regions are the amygdala, hypothalamus, and the hippocampus. So from the hippocampus, signals are relayed via the phonics to the mammillary bodies, via the mammillothalamic tract to the anterior nucleus of the thalamus, and then to the thalamocosingulate radiation, then projects to the cingulate gyrus and back to the hippocampus to complete the circuit. The hippocampus normally serves as the primary output for this limbic structure. So I don't know if you're able to see this clearly, but this is the Papez circuits, suggesting how the impulse are flowing. So we are likely to have some impulse flowing in this manner. So where we've suggested, this is the hippocampus region. So from the hippocampus, this represents an output where neuronal impulses are likely to escape the limbic system. They'll escape the limbic system through the hippocampus. So from the hippocampus, they get into they can get into the cingulate gyrus. So remember, the cingulate gyrus and some part of the phonics are the representation of the cerebral cortex, specifically the temporal lobe. Where from the cingulate gyrus, the information will flow into the anterior thalamus, gets into the mammillary body, and then from the mammillary body, advance all the way to the hippocampus. So while at the hippocampus, some terminating at the hippocampus, and some might end up to the amygdala region. So this is the Papez circuit. Just telling us how the information is flowing. If you're able to follow this cursor, you should be able to follow the movement. So this is how the movement is able to flow within the limbic system. So we are only told that the movement of these signals are very important in controlling the behavioral, the emotional part of our behavior. Remember, we were suggesting mood from a spectrum ranging from extreme sadness that can be termed as depression and extreme happiness that can be termed as euphoria or mania, whereby this represents a level of energies. So these levels of energies are likely to be motivation in terms of the thoughts that you'll be having, and also a motivation in terms of the a particular behavior that you will display. So remember, you can display a particular behavior, but when we are examining the behavior, an intensity is also important. So if you are manic, you are likely to be hyper aggressive rather than a depressed individual. So that circuit, electrical circuit, is referred to the Papez circuits. So just examines how these structures relates electrically. So for you to suggest the limbic system, you have to have the ring of the cerebral cortex and the subcortical structures. So the subcortical structures are what we are able to see over here, or maybe more appropriately over here. So where we've suggested the hypothalamus, we have the hippocampus. We've said that the hippocampus serves as a point of output. So as we output signal from this limbic system, they can be able to get into the cingulate gyrus. And before they advance into the mammillary body around anteriorly over here, they should be able to pass through some part of the thalamus. So if you are to ask to name the structure of the limbic system, just know they are divided into major two: the subcortical structures and the cortical structure. So the cortical structures are the orbitofrontal cortex, the subcallosal gyrus, the cingulate gyrus, the parahippocampal gyrus. Conveniently placed para or adjacent to the hippocampus. And if you extend this anteriorly but inferior, we have the anchors. So this is a cortical area. So this, remember, this is part of the cerebral temporal cortex and some area of the prefrontal cortex where you're having some orbitofrontal cortex. So the subcortical structures, these are the subcortical structures. For the cortical structures, remember, we are having this 1, 2, 3, 4, 5, where we can have them as such. So beginning from the orbitofrontal area of the ventral surface of the frontal bodies, extending upwards to the subcallosal gyrus. So just remember that mapping. We are starting from the orbitofrontal area at the ventral but inferior. Superior to it, you'll get the subcallosal gyrus. Extending medially and also posteriorly, you'll get the cingulate gyrus. Passing behind the corpus callosum and downwards to the ventral medial surface of the ventral lobe, you will get into the parahippocampal gyrus, and extending anteriorly but inferiorly, you will not inferior, slight superiorly, you will find the anchors, as we are able to suggest. So that is just anatomical description to describe the cortical structures of the limbic system and the subcortical structures. So they have a special neuronal connection that we just examine. These special neuronal connections represent the Papez circuits. So whereby you can also have a problem at your limbic system if you are having a lesion at either cortical structure or one of these subcortical structures. And remember also the thalamus is being employed over here. This time round, not from not from the subcortical structure into the cortex, but it is essentially the same thing because as you're passing through the thalamus, you will advance still into the cortical structure. Remember the entorhinal cortex or the hippocampal formation, parahippocampal formation is still part of the cortex. So that is the limbic system. What you need to know, the limbic system still needs to determine the behavior that this person is having. But we just want to add an emotional component into a behavior. And when you add an emotional component into a behavior, it means that it is serving a particular purpose to be able to satisfy the emotional needs of this individual. So if, for example, you are acting in you are opening your mouth and maybe crying and you can, and crying. So crying can be a representation of some certain type of emotion, meaning that you are sad. And you'll not only cry with your mouth, that is referring to the sound that you are likely to hear. We are also likely to see tears coming from your eyes. And this is likely because you are having an adequate stimulation from the limbic system. It is injecting a sad emotion into a particular behavior, so that you are not just crying by way of acting, but everything is likely to achieve that emotional congruence where you are able to see the facial expression suggesting the same, eye tears coming from the eye, and possibly if you are these people, tears should also be coming through your nose. So that is majorly by the limbic system. So in summary, we'll say that the limbic system and the brainstem will activate your brain for you to be able to have some specific form of behaviors. It is also good to note that the limbic system and the brainstem can also have some communication. And what are this communication? So the medial and the ventral surfaces of each cerebral hemisphere contain the ring of the cortex. So this is normally referred to as the paleocortex. Remember, when you talk of the word paleo, means that these are things from a back, or from the old species. So that means if you are somebody who thinks with emotions, will think of you as a person from, I don't want to say from the Homo habilis, but I don't have any other word. So let me say that, whereby most of your thoughts, most of your behaviors are normally informed by the limbic system. So even though the limbic system is important, we want you to display a behavior that is also using the uh, using the executive area of your brain. Remember, the prefrontal cortex will also influence your behavior in it, and it influences your behavior in a more logical way. But the limbic system will also influence your behavior, but influences in a more emotional way. So sometimes you can have a behavior where you say that at the end of the day, I acted intelligently, but I did not acted in an emotional way, in that I was not able to put into perspective what I was experiencing emotionally. So if maybe if it was due to emotion, you will not have acted in a particular way. So that means even as you are firing the brain, we need to have a balance. So back to the limbic system. The paleocortex part of the limbic system. The paleocortex is a representation of all the structures that we've suggested. That is with the cingulate, the parahippocampal, the anchors, the orbitofrontal cortex, and we also have the subcallosal. So that is the paleocortex. So these structures normally are involved with the emotions and the behavior, and they are likely to achieve some or get some firing from the other area of the brainstem. So the limbic ring, so that is the this paleocortex, or the cortical part of the limbic system is also referred to as the limbic ring. It's a two-way bridge between the neocortex and the lower limbic structure. So many emotional and behavioral responses triggered by the hypothalamus and other limbic structures are mediated by the reticular formation in the brainstem, which can enhance the cerebral and the spinal cord excitability. So what you should be getting is the brainstem does not only activate the conscious part of the cerebral cortex of the brain, but it also activates the limbic system. So that means that if the limbic system, if the brain stem is corrupted due to any other disease process, we'll have a reduce in activity in somebody's brain, and also the emotional aspect of the individual is also likely to reduce because for the limbic system to be active, it also requires some activation from the brainstem. So the key communication pathways include the medial forebrain bundle. This connects the septal. Remember the septal as part of the subcortical structures. Connects the septal and the orbitofrontal cortex through the hypothalamus to the brainstem formation. It carries the two-way signals. We also have the short pathways that links the reticular formation, the thalamus, the hypothalamus, and the surrounding basal brain areas to support the rapid interconnection. We suggested that the major part of the limbic system revolves around the hypothalamus. Hypothalamus, the name, it is convenient in respect to the thalamus, meaning that it is somehow inferior to the thalamus. So they have some form of mimicry when it comes to some nucleus that the nuclear or the relay role that both thalamus are playing. That is if I decide to incorporate the hypothalamus as a part of it. Although the hypothalamus is small, only a few cubic centimeters, it plays a central role in the limbic system with a two-way connection to all its levels. So the hypothalamic output pathways. So we can have the backward and downward to the brainstem, that is to the midbrain, the mesencephalon, the pons, and the medulla, and then to the autonomic nervous system. So we can also have the upward pathway. That means to the diencephalon and the cerebrum, especially the anterior thalamus and the limbic cortex. We can also have downward into the infundibulum pathway that controls both the anterior and the posterior pituitary glands. So that is the role of the hypothalamus, an integral part in the limbic system. So we still have a chunk when it comes to hypothalamus. I see, I think let's stop it at this point, and then we continue with the remaining part in the afternoon. So unless there is any question.